Use the buttons on the bottom left of your screen if you need to pause or rewind this video. This module is interactive. If you see bold text that says "Click here," you will need to click the button or area on the screen to advance to the next slide. These items may also become highlighted or have an animation pointing to it. CareCompass is an innovative, interdisciplinary summary workflow solution that guides you as a clinician in the organization, planning, and prioritizing the care of your patients, and provides you with the correct information at the right time. CareCompass displays 90% of all the information you need about your patients directly, including important details such as allergies, resuscitation status, reason for visit, and plans of care. For most nursing positions, CareCompass will be the default screen when logged into PowerChart. Some specialty positions may also have CareCompass. To see if you have CareCompass, click View in the upper left of PowerChart when you're signed in, and select CareCompass if it is on the list. To begin using CareCompass, select the correct patient list from the drop-down. This list will display your personal lists from List Maintenance. If you are using the assignment list that we discussed earlier, it will display the patients you have been assigned in StaffLink by your charge nurse or unit secretary for the current shift. If you choose a list that contains more than 10 patients, for example, a list of the entire floor, the Plan of Care column will disappear from CareCompass. CareCompass is designed to help you work with your assigned patients. There is another tool designed for looking at larger groups of patients called Clinical Leader Organizer. We will discuss this tool in a separate module. The red icon in the upper right of CareCompass, when clicked, will display a list of patients with new orders and results for review. The blue icon will launch a web page for CareCompass help documents and videos. The activity timeline at the bottom of CareCompass can help you plan your day. It provides an overview of the tasks for all your patients each hour. Clicking the color box for an hour will display the details of the tasks due for each patient during that hour. Each patient has a row with information specific to him or her. The columns across the top describe the type of information you are seeing. Click a column header to organize your list by that column, or hover to discover. Hover your cursor over a word that is not fully showing or an icon to discover the meaning. The location column will display the patient's room and bed. An isolation icon is displayed if the patient is in isolation. The patient column displays patient demographics that include name, age, gender, resuscitation status, allergies, diet orders, and the VIP status indicator. You may also see OBS if the patient is in observation. Hover your mouse over the patient's name to view additional information. Click the patient's name to open the chart to the Orders Plan of Care page. The color box around the patient name indicates new information for review. Orange for non-critical results or regular orders, and red for critical results or Stat Now orders. The red delta is the high risk indicator. Hover over the icon to display the patient's high risks and details. These could include risks for falls, aspiration, harm, or readmission, precautions for chemo or seizures, Muse, and sepsis. The orange flag will display the patient's directory status, listed or unlisted. For allergies, you could see the word allergies, no allergies recorded, or no known allergies. Hover to see a list with details. Severe allergies are displayed in red font. The visit column displays the reason for visit from registration and length of stay. The care team column will show the name of the attending physician. Click in the box to display admitting, attending, and consulting physicians. The latest documented vital signs will also display on CareCompass with an emphasis on high and low results. Hover to view documentation details. If necessary, you may right-click and navigate to the Results Review section of the patient's chart. The Activities column displays a graphical representation of the overdue, PRN, unscheduled, and current activities for the patient. Hover over the total number to see a breakdown of due or overdue activities by type. Medications will display medications and the times they are due. Patient care will display CNA tasks. Assessments will display nursing tasks. And Other will display ancillary tasks. You may select an activity type here, such as medications, to view a list of only that type of activity. The blue circle is a quality measures indicator. When clicked, it displays additional information about the ordered quality measures and provides a quick link to the patient's orders plan of care page. The plan of care column displays up to 5 individual plans of care for each patient. If more than 5 exist, a More link is displayed with a count of the additional plans to view. Plans of care will be displayed in the following order and format: planned, suggested, and initiated. Remember, if more than 10 patients are on the displayed CareCompass patient list, the plan of care column will not display. The single patient view from the multi-patient list allows you to view more specific information about a patient in your patient list. While you review and document on the single patient, you can still view all of your other patients on the left side of the dashboard, which is the multi-patient list. From the single patient view, you have 4 tabs across the top with different types of information. You can filter by activity type. You can view 2, 4, or 12 hours into the future. And you can see your full activities list. You can access the single patient view by clicking the arrow on the right side of the patient column. You can also access the single patient view by clicking the circled number in the activities column. Right-clicking in a patient row displays a list of options and quick links to the chart. Clicking the blue patient name will open the chart to Orders Plan of Care. To navigate back to CareCompass, click CareCompass in the toolbar. The patient chart will remain open behind CareCompass until you close it by clicking the X. To document activities from CareCompass, select the arrow next to the patient name to open the single patient view. Click Continue to view a demonstration. Select the activity or activities you want to complete. For this example, select Blood Glucose Bedside. The available charting options for the selected task display on the bottom right. For this example, select Done. The activity is removed from the activity list. If documenting not done, a reason may be required. Select or enter the reason and click the green check mark to sign. The scroll bar on the right allows you to look through all the activities due within the selected time frame, 2, 4, or 12 hours. Click Continue for a demonstration. Hover over the activity type icons to display their meaning. Medications, patient care, assessment, and other. The dark gray color indicates that the item is selected and appearing in your view. Click an activity type or time frame to select or deselect it. To close the single patient activity view, click the X in the upper right of CareCompass. Clicking the total number in the activities column or the arrow in the patient column opens the single patient activity view. To open a single activity type, click the total number and select the type to open. For this example, click Medications. The activity list is now displaying only medications. This particular screen may be helpful for nurses to plan before administering medications from the Cerner phone. Chart any meds not done from here to shorten the list on the phone. Another helpful tool in CareCompass is the activity timeline. The activity timeline is a graphical representation of all the activities that are due from all of the patients on your list. This informative rolling 12-hour view allows you to adjust your priorities accordingly. Positioning the pointer over the activity bar for a specific hour in the activity timeline displays activities that are due in that hour. Select an activity to chart it from here. The activity timeline can be collapsed by clicking the down arrow to display an additional patient on your list. In the upper right of CareCompass, there is a question mark icon. Click the icon to open the CareCompass help pages. Select the help material for the area you would like to know more information about. When finished, close the web page to return to CareCompass. Thank you for completing the Cerner CareCompass tutorial. Please refer to your manager or preceptor for specific location workflow information.